Assalamualaikum and good morning to Miss Cheney. My name is Nurul Aina Biha binti Muhammad Asri. Today, I and my crewmate will present about safety and health. So I will start it with an introduction. In 2021, Malaysia has recorded 174 people suffer from fatal injuries. So this means that employers and employees do not practice safety and health in the workplace. Before we delve into this topic further, we better know about the history of the existence of safety and health. This occupational safety and health was established in 1917 by the President Nixon resigned. Due to this act, safety and health in the workplace is getting better and can reduce accidents. While in Malaysia, this act was established in 1994, this act also applies throughout all the Malaysian and has been approved by His Majesty the King. This Safety and Health Act is very important because it will protect employees from any accident and can provide guidance to any premise in health and safety. For example, in Malaysia, a teacher cannot take their student anywhere, even for a reason, because it has violated safety law. So the school as an employer need to provide transportation for students and their teachers. That's how the safety and health law benefit both parties. This Safety and Health Act will also produce guidelines, rules, investigating, inspecting, and levying fines. Other parties also need to play a role in maintaining safety and health. For example, the manager need to correct the employee if they make any mistake. So that's only for introduction, and I will pass it to another person.
Hi guys, so my name is Nur Sarah binti Muhammad Rashdan and my ID is 2021875002. So my part, I'm going to talk about definitions of occupational safety and health. So occupation, health and safety (OHS) can be termed as the rules, legislations, policies, procedures and activities intended to care for the health, safety and welfare of the workers and all the individuals in organizations. It involves looking at the social, mental and physical well-being of workers. Moreover, occupational health and safety in an organization help uphold and sustain a high threshold of physical, mental and social well-being of all the workers and their employer, such as protect workers from adverse health effects emanating from poor working conditions, shelter workers when carrying out their activities from risks emanating from factors unfavorable to their health, and finally assist workers adapt physically and mentally to the working environment. It is important, therefore, to ensure that occupational health and safety is observed. It decreases the risk of illness, death and injury to workers and other individuals as a result of bad working conditions at a specific workplace. That's all. Thank you from me.
Alright, so next I will explain about occupational safety and health concept. And before that, let me introduce myself. My name is Muhammad Ahmad. My matrix number is 2021845284, and I will explaining about occupational safety and health concept. So before we go through this concept, this occupational safety and health concept, let's see the history first. The history of the occupational safety and health concept. It was begun before the 18th century. The notion of occupational safety and health was unknown. It began in a Western country, and it's mainly about the community concerns about the youngsters that are working in cotton mills in United Kingdom. However, the police imposed some limitations on the employment hours of children and teenagers, and sadly, there was no formal legislation on this problem until 1883, when Otto von Bismarck was the first to introduce the Social Insurance Act and the workers' compensation that took place in the Western countries, and the other countries also, on the other hand, followed suit later. Right, so in this video, I will explain about 5 key of the occupational safety and health concept. We will see the similarity each of the concept with one another concept, and we will see the connection between each of the concept with one another concept. Alright, so the first one is it and risk, hazard versus risk. Right, the first one is hazard. So what is hazard? Hazard can be known as the root of the harm that has been discovered that affects people's mental, physical and cognitive condition. So I will give you an example. For example, a wild and hungry tiger initially can be identified that the tiger will hurt you, while the risk is uncertainties impact occupational safety and health risk. The possibility severity of a work that related to hazard surrounding or exposure that occurring, as well as the illness and injury induced by the exposure or event, this is probably the continuation of the hazard. So, for example, the tiger can bite you or give you a scratch. So here come the odds and the impact that may have one or another consequence of the tiger walking nearby. So I hope that you're clear enough about what is hazard and what is risk. When we talk about risk, we must be aware that risk assessment is one of the concepts. It is the method of assessing the risk of the hazard around the workplace and employee safety. So what is risk assessment? Alright, so risk assessment is the foundation for putting in place effective management measures. Risk assessment also is the first and most important element in managing the OSH risk, based on the framework directive. It also can be done in a variety of ways, from simple to complicated. Risk assessment entails assessing, rank, and categorizing risk, detecting workplace hazard, assessing risk, determining whether current controls are appropriate, and priority steps if further controls are required. It is critical that all workers in the organization participate in the risk assessment, and it is to guarantee that hazard analysis relies on employees' expertise, which can call awareness to dangers which are difficult to spot, such as hazards emerging from machinery. So next is accident versus incident. So what is accident and what is actually incident? Right, so accident here means unforeseen incident that causes harm to property, people, materials, and the environment. Incident is emerging from or in the working period that can relieve or would causes injury and illness. That is, injury and illness having an undesirable influence on the person's mental and physical or cognitive status, or can be defined as something unplanned, seen, but not damaging material. This should be emphasized that this concept fairly includes phrases including such occupational sickness and occupational injuries, which has been described in the terms of employees' compensation schemes. So here are the example that can clearly image an accident and incident connection. If you slip off a pool of water and injure yourself, it's called as accident. And if it was merely the fear of falling, it was an occurrence because you were not wounded. So this is called incident. But some argue that it's not even linear and causes. The last one is prevention, one of the most important concepts in occupational safety and health. So what is prevention? Prevention refers to all procedures or measures done or strategized to avoid or reduce workplace hazards at all phases of work. OSH emphasized the importance of prevention. In reality, besides then aiming to remedy issues after they have already occurred, all of the OSH management system should focus on preventing occupational illness and injuries. And this notion is becoming increasingly important as organizations change quickly due to globalization, temporary work, downsizing, subcontracting, part-time work, and lots more. A dynamic approach necessitates the OSH, which includes developing the OSH programs with a specific objective and incorporating OSH operation into the other company system and procedures. So that's all from me. I will pass over to the next person to explain more about this topic.
I will explain about guidelines of occupational safety and health. Occupational health services are services to build and maintain a welcoming environment that will promote good overall health at work. This guideline means to supply protection and promote the employee's safety while they carry out activities in the workplace. This also serves to boost an organization's working condition and working environment. The first step to build a safe and healthy working environment is to create a safety plan that everyone in the organization can access to. These safety plans are used to examine and update their work safety procedure on a continuous basis to avoid and minimize emerging dangers in the workplace. Next is keeping records. This organization needs to keep records on accidents and that arise within the organization to understand the risk factors involved and to work towards avoiding them in the future. Keeping record will also help to minimize the factors that lead to workplace injury. The third one is to provide a proper safety equipment to every employee in an organization. Firstly, the organization needs to make sure that their personnel has access to the safety gear and equipment. This is to decrease the potential of being exposed to hazards. The next one is to eliminate potential hazard to maintain a safe workplace free of physical, mechanical, and chemical dangers. The organization needs to ensure that first aid kits are conveniently accessible and use complying label and various sort of signs such as danger, warning, and caution. This serves to encourage employees to detect and report potential dangers and take immediate action to rectify the issue. Lastly is to provide proper training to all employees in an organization. A proper training helps to reduce risk, especially if the job involves a possible threat. The organization needs to ascertain that all employees have completed any required safety training and keep a watch on a staff to ensure they are following safety rules. The training serves to make all employees become more aware of various situations, such as learn how to detect, report, and control workplace dangers. This guideline is needed for organization because health and safety in the workplace is a priority, and employees play an important role to keep their employees safe so that they could be more productive and produce better results in their work.
So, in this case study, I would like to describe about Minister of Health. The Minister of Health, also known as MOH or TKM, is a Malaysian government ministry in charge of health-related matters affecting the country. So, in this part, I want to tell you about the background of MOH, example of occupational safety and health, and also what advantage occupational safety and health have. So, I can share with you about the background of MOH first. So, for your information, the health services in the country started before independence. The construction of the hospital at that time was to treat workers in the tin mining industry. So, each mine worker had to pay 50 cents per year for treatment. In 1880, Hospital Taping, or formerly known as Hospital Nyewa, was established. This hospital has made history because it is the first hospital to have X-ray facilities after the creator of the facility, Professor W.C. Rawlinson, introduced it to the public. In 1900, an outbreak of frequent infectious disease such as malaria and beriberi led to the establishment of the Institute of Medical Research (IMR). With the assistance of the IMR was intended to make a study on the cause of this infectious disease spread and find out how to control the infection, especially in tropical disease. After the establishment of health services, it followed by the assistance of dental service with the establishment of the first government dental clinic in Jalan Silang, or formerly known as Jalan Tun Tan Sri Sin, Kuala Lumpur in 1929. Next, they planned to build a nurse training college, and it was established in 1949 in Penang to train nurses how to use dental technology and dental surgical assistance to ensure the people enjoy better dental services. On 13 January 1992, the college began basic training for medical assistants with 50 participants. However, the history of this college started much earlier in 1956 due to the way of providing training for assistant nurse. Subsequently, in 1970, it was used to train junior hospital assistant, while in 1992, the Manpower Planning and Training Division decided to make the college a medical assistant training, which provided training according to new diploma level medical assistant curriculum. In addition, Sarawak also recorded the history of health services. It began during the time of James Brooke, where hospitals were built specifically to treat European officers and their families. Not only that, local girls are also trained to become nurse and midwife in Kuching. During the colonial era, services in the state that had focused on medical treatment in urban areas. In 1881 to 1942, the health service in Sabah was established by the North Borneo Chartered Company, which ruled the state at the time. During the period of the merger, the ministry was known as the Ministry of Health and Social Welfare, with its first minister, B. Datuk V.T. Sambatan, who carried out his responsibility from 1957 to 1959. However, starting from 1963, the ministry was changed back to its original name, that is the Ministry of Health Malaysia, with the fourth minister, Y.B. Datuk Abdul Rahman Talib, in 1962 until 1964, whose name continues to remain until now. Now, the focus of the Ministry of Health Malaysia has become wider, especially in providing fair, accessible and quality health facilities. This development is in line with the changing patterns of environmental health, the development of globalized health technology and liberalization according to the changing patterns of disease, environmental health and technological developments at the world level. Next, I want to share with you an example of OSHA. In this case, I choose to explain about guidelines on chemical management in healthcare facilities. These guidelines were created to meet the needs of the Ministry of Health healthcare facilities, which include hospitals, health clinics, and dental clinics. Next, I want to describe law and regulation related to hazardous chemicals.
Occupational Safety and Health Act 1994 that it is very employer and self-employed person responsibility to the greatest extent possible to provide a safe and healthy working environment for all employees. The list of regulations pertaining to chemicals under this Act are Occupational Safety and Health in classification, packaging and labeling of hazardous chemicals on Regulation 1997, prohibition of use to substance on Order 1999, use and standard of exposure of chemicals hazardous chemicals on Regulation 2000, and the last notification of accident, dangerous occurrence, occupational poisoning and occupational disease on Regulation 2004. Furthermore, for duty of supplier, they need to classify the hazardous chemicals based on physical chemical properties, health effect like this material toxic or not, and also label the chemical according to the requirement of Hazardous Chemical Regulation 1997 and make sure the label should both be in Bahasa Melayu and English. Next, the label must have the name of chemicals, materials, address, telephone number and name of supplier, danger symbol and safety measure. And the last is about occupational safety and health in notification of accident, dangerous occurrence, occupational poisoning and occupational disease Regulation 2004. In this section and their scope is according to this regulation the importance of medical practitioners reporting suspected or diagnosed occupational disease and poisoning to DOSH is to determine the underlying cause so that remedial actions can be taken to prevent similar incidents, as well as to monitor trends in occupational accident, poisoning and disease as a basis for planning and the establishment of new policy or program and law enforcement. And last, I would like to share about the advantage of OSHA. Why is OSHA very important? OSHA actually wants to design to protect the workers in the workplace from any workplace accident, hazardous substance exposure, and some injuries. Because an incident or accident can happen at any time in the workplace, employers must be responsible and take precautionary measures to reduce the risk of an incident or accidents, as well as provide an orderly and safe working environment. Every employer should prioritize occupational safety and health in the workplace because it has several key benefits, including the ability to reduce the risk of accident or injuries. This can help you to identify and mitigate workplace hazards. There are several types of workplace-related hazards, including biological and chemical hazards. An example that can be taken is the Malaysian Ministry of Health. As a result, biological hazards can result in serious illness, infection, and health problems. These dangers include virus, bacteria, and fungi that are spread through the air and blood. This hazard is also a major contributor to sick building syndrome. Next, chemical hazards include some carcinogenic and corrosive chemicals. These substances can be inhaled as gas or vapors, or they can come into contact with the skin as liquids or solids. Chemical hazards can cause irritation, breathing problems, blindness, and other serious health problems. As the MOH has identified the hazards that have in the hospital, they must take the necessary steps to mitigate the risk that will be encountered as a result of the hazard. The process of identifying practical measures to eliminate or reduce the risk of injury or illness in the workplace is known as a risk control. In light of the current situation, this risk control measure must also be reviewed on a regular basis to ensure their effectiveness. The authorities should include this discussion and consultation with employer representatives in any planning or strategy to implement such risk control. In addition, a conducive and safe work environment can contribute to increased work efficiency and productivity because the health of employees is guaranteed in terms of physical, mental, and emotional. Employees will be less stressed at work and more enthusiastic about coming to work. As a result, the employer-employer relation will be improved. Thus, employers can undeniably reduce the cost of losses associated with the management of accidents or injuries, which are closely related to the cost of healthcare and rehabilitation, productivity losses, impact on employee well-being, and legal action.
The KEDRA system, which is Occupational Safety and Health, is a well-known national policy in the Malaysian occupational industry sector. This conforms to the fundamental purpose of preserving and ensuring all of the employee safety and health. The aim is to ensure that any potential hazards or risks that may affect the staff are always being controlled and be the most important topic in the employee safety and health framework. This also contributes to the well-being and productivity of the country's workforce. This is because job productivity is intimately tied to workforce quality. We have previously discussed various essential themes that are connected to our group basic vision, which is to review the safety and health policy that have been implemented in the Malaysian employment sector with the help of the Ministry of Health, MOH, which is serving as the primary implementation target. Based on the essential factors, we can conclude that the K3 system should be appropriately implemented for all the employees, especially those who work in the health sector, such as the MOH staff. Why this is such an important topic that should be discussed in the health sector is because it is done to guarantee that the procedures and techniques that used for the work are correct and the percentage of errors committed for each operation is as minimal as possible. This also seeks to ensure that no flaws exist in the nursing care provided. Therefore, a variety of procedures and methods must be carried out and followed by all of the personnel based on the guidelines set in each section of their work to ensure each employee's welfare is taken care of while minimizing the danger of workplace accident resulting in unwanted injuries. Working in the health sector will not secure the safety and welfare of workers, as the percentage of accidents and injuries among health sector employees is higher due to all workers are being exposed to numerous diseases that are often invisible to our naked sight. For example, that we can see as virus COVID-19. So, every staff in the health sector needs a specific attention and must go through multiple health training process. All processes must be carried out following with the MOH recommendations and guidance, as they are the largest organizational body in the health sector. This is done to ensure all of these procedures can secure the health sector's seamless workflow and there are no flaws or defects that can be occurred to every workforce in the health sector. Thus, the health management must ensure that the safety and health of every staff in the sector are being prioritized in each department as they are performing each of their duties to the best of their abilities.